I've been with OB Hospitalist Group for 2.5 years. I've done a number of rewarding things, stat C-sections and other exciting uh, save the day kind of moments. But uh, one of the experiences that will really stand out to me, I think, for most of my career is our role in helping with the Afghan refugees in 2021. And my hospital in Virginia, which anyone who watches CNN knows, Virginia was the entry point for most of these unfortunate folks being displaced from their homes and coming into the United States. We Because of OB Hospitalist Group is the safety net for the hospital, we are obviously tasked with taking care of patients who don't have doctors. So naturally, these patients fell to us. And there were loads of patients who were pregnant or recently delivered who needed our help and after they arrived into the United States. Our group started seeing these patients that first day that the pictures of the cargo planes were being shown on CNN, and the numbers just escalated rapidly from there. And one thing we noticed very early on was in talking to these patients was they were going 18 to 20 hours without eating. And it's not because the military wasn't feeding them, it's that the military didn't have halal options in their MREs and other quick meals that they were trying to provide en route. So one of the first things I did, I remember I grabbed one of the translators in the ER and these translators were just volunteers from the community doing this out of the goodness of their heart. And I pulled him aside and said, I need like a 5 to 10 minute rundown on halal meals and how I can make this work with what the hospital has available. And then I was able to meet with nursing administration, and within about 12 hours, we were able to put together a menu of what we already had in the hospital that would comport with the religious requirements. And that allowed us then to start giving food to these poor folks that had gone a long time without eating. 18 to 20 hours is a long time for a pregnant woman to go without eating, borders on a safety issue. We then made it our priority, our group, no matter what the person was there for, whether it was to find out if they were in labor or just to get their blood pressure checked, to immediately start trying to feed them and anyone who was with them. And this worked out really well, and the kitchen and everybody was super cooperative in making this happen, and it seemed to be a very appreciated gesture. One of our other challenges we ran into very early on was a number of these patients didn't want to, they concealed what was wrong. They didn't want to tell us what was wrong. And first off, we didn't always know because a lot of people don't realize, but there is no Afghanistan language. It's Dari, Pashto, Arabic, Farsi, Urdu, and then there are dialects within that. So even with the best efforts of screening and translators, it was sometimes patients arriving at the hospital without us knowing what was wrong. And then some of these patients concealed what was wrong because they didn't want to be separated from their families. And how can you blame them? A lot of them had walked on foot through literally a war zone to this base, flown to the United States, and then they're threatened to be separated by the EMS system of all things. So we did what we could to modify our triage evaluations, speed things up, constantly giving reassurance through the translators. We are going to try to get you out of here in 2 hours. You will not miss your bus to wherever you're going. We will get you back to the airport where your family is. I just want to check your blood pressure. I just want to make sure this lab is okay. Because we also knew we weren't going to have any follow-up with these patients, and we did not want anything to slip through the cracks. And I think everybody on my team did a really good job of that in offering top-notch care to these patients despite the challenging situations. And the challenges escalated because we soon got into, as everyone saw on the news, measles and COVID and some other medical situations that had just not something we run into as often in our daily lives. But it was our relationships with the hospital administration, other physicians in the hospital, and with nursing really positioned us not only as being the ones to take care of unreferred doctors, but I felt we were very well positioned to utilize the hospital resources to adapt what we were doing and provide high quality care for this group of people. And I felt very strongly about it because most of them, we found out very early, were associated with our military, and I had a Navy background myself. So really felt appreciation for what they had done, and really felt it important to give everything we could to take good care of these men and their wives. So again, I've done a lot of rewarding things with OBHG, but this is one experience that's really going to stand out for me moving forward. And I really appreciate the opportunity to have been a part of it.